Hi, everyone. In today's episode, we're going to talk about the effects of music on pain relief during labor. Hi, everyone, and welcome to episode 35 of the Evidence-Based Birth Podcast. I'm really excited about today's topic because I'm an amateur musician. I grew up playing piano and flute, and in college, I had piano scholarships. So this is a topic that I was really interested in exploring the research about. First, I wanted to talk a little bit about music therapy in general, and this information comes from the American Music Therapy Association and an article published by Bradley Palmer in 2015. Now, the field of music therapy is a relatively new, non-drug, professional medical practice that aims to promote the well-being of people of all ages, both sick and healthy. Music therapy is used in clinical settings and in the home setting to provide relief to people suffering from acute and chronic pain, brain injuries, mental conditions, substance abuse, aging-related conditions, as well as a wide range of developmental, learning, and physical disabilities. But how might music therapy or music in general work to promote comfort and lower pain levels during labor? Well, researchers think that music might change how a person perceives pain by decreasing its unpleasantness. According to something called the Bonipace and Marchand classification, music acts through the higher centers of the central nervous system called the Central Nervous System Control Mechanism, or CNSC, to relieve pain. Now, these parts of the brain in the central nervous system are closely associated with memory and emotions. So this means that listening to music may activate mental processes during labor that help make potentially painful stimulations seem less unpleasant. Other examples of CNS methods that work similarly to music include hypnosis, aromatherapy, and continuous support. Researchers also think that listening to music may work by stimulating the pituitary gland to release endorphins, which are natural pain-relieving hormones, and by increasing levels of serotonin, which are a neurotransmitter. In addition, music may alter your perception of pain by promoting relaxation, reducing anxiety, and providing a pleasant sense of distraction during labor. So what is the best type of music to listen to during labor? Well, in 2012, researchers published a paper that looked at what makes the best music for relaxation. 14 music therapists recommended and analyzed 30 selections of music. Then a group of 80 healthy adults listened to the music and rated the music based on how it made them feel. The researchers found that there are certain intrinsic properties in music that make music relaxing. These include tempo, harmony, rhythm, instruments, melody, voices or vocalization, and pitch. An important finding from this study was that people's familiarity with a type of music and their preferences for music were strongly linked with how relaxed they felt when they listened to the music. In other words, music is deeply personal. There are some objective qualities that might make music relaxing, but music is also very subjective, and something that might be relaxing for me might not be relaxing for someone else. I once had a friend who gave birth who had trained as an opera singer. She told me afterwards that she listened to her favorite opera music throughout her labor using earbuds. She said that she literally did not feel pain during her contractions. Now, this is someone who did not train in self-hypnosis or any other technique that would make her have a painless birth. So after hearing her story, I was really curious. What does the evidence say about using music for pain relief during labor? Was this a fluke, or is this something that could be effective for lowering pain levels? Well, in 2018, a group of researchers led by someone named Smith carried out a Cochrane review and meta-analysis on all different types of relaxation techniques for pain management in labor, and they included music in their review. They found 3 randomized controlled trials that compared music to no music control in women giving birth without pain medication in Italy, Taiwan, and Turkey. The researchers found that women reported significantly lower pain levels during early labor when they were listening to music. However, they found no clear benefit from music during the active phase of labor. During the active phase, the average pain intensity was about an 8.6 in the control group, and it was about 0.5 points lower in the music group, but this difference was not statistically significant. So technically, we have to say there was no difference in pain levels between those two groups. However, this was a small number of patients. Only about 217 patients had their pain assessed during the active phase of labor. So it's possible with a larger study that we would have seen a significant result. There was also no evidence of a decrease in anxiety in the music group during early labor or the active phase of labor. This info came from 2 studies with a total of 192 participants. However, one trial with 132 women did find a reduction in anxiety during the transition phase of labor in the music group. None of the studies in this Cochrane review that looked at music reported on any satisfaction with pain relief, sense of control during labor, or overall maternal satisfaction. Another review was published in 2014 by Hollins Martin. This review looked at 5 studies that examined the experiences of women who had music administered during labor. In all 5 of the studies, the participants were having unmedicated births, so they did not have pain medication. They found that in 4 out of the 5 studies that music did improve women's experiences compared to having no music. For example, in one of the studies that was published in 2003, 110 mothers in Thailand were randomly assigned to have either 3 hours of soft music without lyrics during active labor, or to have no music. The women who were given the soft music reported significantly lower pain scores. There was also a randomized controlled trial published by Suruku in 2018 that was too new to be included in the Cochrane Review. In this study, they looked at 50 healthy first-time mothers who were giving birth without pain medication at a hospital in Turkey. The mothers were randomly assigned to give birth while listening to a specific kind of Turkish music called asamasaran, mood music, during active labor, or no music, which was the control group. The music group listened with their earbuds for 3 hours. They could have 20 minutes of listening and then 10 minutes of a break. None of the participants refused to listen to the music, and they all kept listening. Now, there was no significant difference found in their pain scores before the intervention started or after the first 30 minutes. But they found that the music group had significantly lower pain scores after the first hour of laboring with music and every hour after that. Even after the music intervention ended, so after the 3-hour intervention period was over, the music group continued to have lower pain scores compared to the control group. And on average, after 4 to 6 hours of labor, so several hours after the intervention was concluded, the music group continued to have pain scores that were about 3 points lower on average using a visual analog scale, which is a pretty significant difference. Using the FACES anxiety scale, they also found that the anxiety level of people listening to music was significantly lower compared to the control group when they assessed them after the intervention period. The researchers also surveyed the participants 1 hour after the birth, and all 25 mothers in the experimental group said that they liked listening to music during labor. When they were asked to rate the difficulty of their labors, the music group rated their labors as less difficult on average, and 88% of the mothers in the music group said that music was at least partially effective at reducing their pain. Only 3 women did not find it effective. Now, several other types of music that we don't have a lot of research on yet, at least when it comes to childbirth, is something called entrainment and something called binaural beats. The definition of entrainment is your body's ability to respond to and synchronize your sound and rhythm and emotional state with the music's tempo. So the music starts and then slowly progresses to a more relaxing tempo in order to promote relaxation. Another type of music therapy method is using something called binaural beats. That's spelled binaural. This happens when both ears receive 2 tones that are slightly different frequencies simultaneously. So this means if you have earbuds in and you have slightly different frequencies of music delivered to each ear, your brain actually generates a music beat that is equal to the difference in the frequencies, and that's called a binaural beat. Now you can search on YouTube for all kinds of videos that demonstrate binaural beats that people use for pain relief. Researchers think that binaural beats might alter your brainwaves, although this is controversial, with different researchers finding different results. So the evidence on binaural beats is conflicting, but it's important to remember that music is more than just sounds. Music is inherently emotional, and it probably has benefits that are independent of just the different types of sounds and frequencies. Now, in conclusion, the studies on using music during labor for pain relief are mixed, but for the most part, most studies seem to find benefits. There's evidence from 2 randomized trials that music helps relieve pain during early labor. There's also evidence from one trial that music may help during the transition phase of labor. A recent study, although small, of 50 mothers from Turkey found that music lowered pain scores and continued to lower pain scores even after music had stopped. In addition, music also lowered anxiety. Of course, one limitation in all of these studies is that people in the research studies knew which group they were assigned to. So there's something called the Hawthorne effect in research, where when people know what intervention they're getting, they're more likely to have a beneficial effect because they know they're supposed to have a beneficial effect. With music, it's impossible to blind people to whether or not they're receiving music. Also, since music is stimulating to your central nervous system and affects your memories and emotion, people probably find music more beneficial if they pick it out themselves. Or on the other hand, one option would be to pick out music and then train yourself over time during pregnancy to relax to that certain type of music and to have positive thoughts and emotions and feelings when you're listening to that music, and then use that same music during labor. Some people may prefer classical music. Other people may prefer something that's more personal to them. For example, going back to my friend who's an opera singer, she chose music that was incredibly personal to her, that she was extremely familiar with and she had trained herself with. And again, research has found that your familiarity and preference for music are strongly linked with how relaxing you find music to be. The bottom line is that using music for pain relief during labor has benefits. It's freely available and it doesn't seem to have any side effects. It may improve the experience of childbirth by lowering anxiety, potentially lowering pain, and promoting a sense of relaxation. My research assistant, Anna Bertoni, and I put together this podcast outline with help from Kate Taylor, a board-certified music therapist. So we wanted to say thank you, Kate, for all of your help, and thank you, everyone, for listening today. Before we go, I just have one more quick announcement for you. And that is to keep an eye on your email if you're part of the Evidence-Based Birth newsletter. For those of you who may be interested in joining the Evidence-Based Birth professional membership, we're going to have a unique opportunity this coming Friday through Monday, and that will be to join the membership at a quarterly rate. This is something we haven't offered in almost 2 years. And what it lets you do is join the professional membership for 3-month time periods at a time. So it definitely saves you money over a monthly membership, but it's not quite as big an investment as purchasing an annual membership. So if you're interested in taking advantage of this sale, just keep an eye out for the announcement coming out this Friday. Next week, we are going to be moving on to evidence on using the rebozo, a traditional Mexican technique for pain relief during labor. So see you all next week. Thanks. Bye.